The subcommittee will come to order. Chair will recognize himself for an opening statement. On July 1st, 2014, the Department of Health and Human Services Office of the Inspector General released two disturbing reports regarding eligibility verification for individuals purchasing coverage in the exchanges. According to the reports, between October 1st and December 31st, 2013, OIG identified 2.9 million inconsistencies between applicants' information and data received through the data hub or from other data sources. 1/3 of these is related to income. Resolving these inconsistencies is often critical in determining eligibility for the nearly $1 trillion in exchange subsidies that are being spent over the course of the next decade. And this is why Congress passed a law requiring the Secretary of HHS to certify that processes were in place to verify eligibility before subsidies were made available. Secretary Sebelius made such a certification to Congress on January 1st, 2014. Yet, one OIG report states, quote, as of the first quarter of 2014, the federal marketplace was unable to resolve about 2.6 million of the 2.9 million inconsistencies because the CMS eligibility system was not fully operational. It was unable to resolve inconsistencies even if applicants submitted appropriate documentation, end quote. It is clear that the eligibility system is far from operational. CMS reports that it now has in place an interim manual process to resolve inconsistencies, and it hopes to have a fully automated process later this summer. It is absolutely stunning that this administration, nearly a year after the launch of the exchanges and with $1 trillion on the line, has yet to build a functioning eligibility system. Given the administration's false promises when it comes to Affordable Care Act implementation, CMS hope to have a fully automated process up and running later this summer deserves to be treated with skepticism. From telling Americans falsely that they could keep their health plan and doctors, to Secretary Sebelius' commitment that the exchanges would be ready to launch on October 1st, implementation of this law has been a series of broken promises. Additionally, this problem appears to be getting worse, not better. According to documents released by this committee as of May 27, at least 4 million inconsistencies have been identified. These facts make it clear that the administration is taking a, quote, shovel the money out the door first, verify later, end quote, approach when it comes to exchange subsidies. It is simply unacceptable that CMS does not yet have the internal controls necessary to validate Social Security numbers, citizenship, national status, income, and employer-sponsored coverage. Americans sending taxes to Washington don't deserve to have their money so blatantly disregarded by a federal government that is supposed to serve them. OIG has recommended that CMS, quote, should develop and make public a plan on how and by what date the federal marketplace will resolve inconsistencies, end quote. But one has to wonder how long it will take to clear this backlog and whether proper internal controls will be in place to prevent this from happening again during the next open enrollment period this fall. One also has to wonder how the administration intends to claw back any improper subsidies that were given as a result of inaccurate information. Middle-class families could be left on the hook for thousands of dollars in payments back to the IRS as a result of this failure. My time has expired. I yield back and now recognize the ranking member of the Subcommittee, Mr. Pallone, 5 minutes for an opening statement.
Thank you, Mr. Chairman. Let me welcome the Office of the Inspector General's representatives here today. The work you do is invaluable to our committee and Congress, and there's always a role for us to strive to do better so we can ensure that taxpayer dollars are well spent. But I think there's some important lessons I hope we can learn from today's hearings. The first and most important is the fact that a data inconsistency on a consumer's application does not equate to errors. In fact, nearly all of the cases of inconsistencies can be easily resolved. The second lesson is that we should use OIG to learn how we can strengthen our federal programs, not as a political blunt object to mislead the American public. We get it. Republicans don't like Obamacare. In fact, they won't recognize one single benefit from the law, and they've predicted one disaster after another, and none of them have come true. I respect my chairman a lot, but I mean, all I kept hearing in his comments about how we're so worried about this subsidy. Well, you know, this subsidy goes to middle-class people, not to poor people, not to rich people. I think it's something between $25,000, $30,000 and up to maybe $80,000 or $90,000 for a family of four in order to get the subsidy. That's the middle class. That's the middle class that we're trying to preserve. These are the average Americans. Why are they so worried about, you know, a subsidy for middle-class people instead of worrying about the big corporations or the oil companies? And I could have a hearing for 10 hearings on all the subsidies for the oil companies, and God knows what they're getting away with. These are not the fat cat contributors. This is the average person. And the ACA is working. The results are in. 3 independent surveys support this claim. During the law's first open enrollment period, 9.5 million previously uninsured Americans got health coverage, reducing the uninsured rate amongst working adults from 20% to 15% in less than a year. According to Commonwealth Fund survey, the overwhelming majority of the newly insured, including 74% of Republicans, are satisfied with their coverage. Now, that doesn't mean the law is perfect. No one on my side of the aisle is arguing that, but we've had some technical hiccups with enrollment. The reports that OIG will discuss today, I believe, are a reflection of those challenges. We've learned how to improve the process, and this fall, the hope is to strengthen the system even further and capture millions more Americans who need health care coverage. But if Republicans really want to talk about taxpayer dollars being spent wisely, let's have that conversation. We can talk about Speaker Boehner's frivolous lawsuits against the president, or the wasteful $3 billion being spent on this repetitive, unnecessary Benghazi fishing expedition. And then there's the $2.3 million they spent defending discrimination in the courts during the Defense of Marriage, or DOMA case. The House GOP is interested in wasting taxpayer dollars to score political points. The ACA, on the other hand, is helping people get access to health care, and it's saving lives. So I just ask my colleagues to stop the political stunts, stop trying to dismantle the ACA's success, and come together with Democrats to strengthen and improve its historic benefits and protections. We're trying to help the middle class. That's what this is all about. And without that subsidy, they're not going to be able to get health insurance. So I'd like to yield now 1 minute to Congressman Green from Texas.
Thank you, Mr. Chairman. I thank the ranking member for yielding. According to the recent report from the Commonwealth Fund, 9.5 million additional adults ages 19 to 64 are now covered by insurance. 73% of the people who have bought in health plans and 87% of those signed up for Medicaid said they were pleased with the new insurance. Even 74% of the newly insured Republicans like their plans. Mr. Chairman, there are certainly shortcomings in the Affordable Care Act, both in policy and implementation. But as I always say, if you want something perfect, don't come to Congress or a legislative body. Yes, the 9.5 million newly insured and millions more benefiting from reforms included in the law. It's long past time to move beyond political posturing and misinformation campaigns to get back to business. It's time we start working to improve the law in ways where there is broad agreement. The American people deserve better, and I hope to work with my colleagues to build on this success and make changes that best serve the public, and I yield back my time.
Now to the gentlewoman from Florida, Ms. Castor, the remainder.
Well, thank you, Mr. Pallone, and thank you, Mr. Chairman, for calling this hearing on how we improve the Affordable Care Act for America's families. I appreciate the Inspector General's office, all of the work you've done to help us identify where we need to improve. Why is this important? Millions and millions of Americans are depending on us. And I look at my home state of Florida, we surprisingly had 1 million Floridians sign up through the federal marketplace. It's remarkable. But now we're going to face a different open enrollment period starting November 15th to February 15th. We've got to ensure that this is working for our families. So help us prioritize where we have to pay additional attention. Help us make this better for America's families. Thank you, and I yield back.
Chair thanks the gentlelady. All members' written opening statements will be made a part of the record. On our panel today, we have two witnesses, Ms. Kay Daly, Assistant Inspector General, Office of Audit Services, Office of Inspector General, U.S. Department of Health and Human Services, and Ms. Joyce Greenleaf, Regional Inspector General, Office of Evaluation and Inspections, Office of Inspector General, U.S. Department of Health and Human Services. Thank you for coming. While we have two witnesses on our panel today, I understand their statements are one and the same. So I will ask Ms. Daly to present the joint statement, and then both witnesses will be available for questions from members. Ms. Daly, you will have 5 minutes to summarize your testimony. Your written testimony will be placed in the record. You're recognized for 5 minutes.
Thank you, and good morning, Chairman Pitts, Ranking Member Pallone, and other distinguished members of the committee. Thank you for the opportunity to testify today about two new reports from the Department of Health and Human Services Office of Inspector General. These reports provide a first look at a critical component of the health insurance marketplaces that were established under the Affordable Care Act, their verification of enrollee eligibility. Accompanying me today is Joyce Greenleaf, our Regional Inspector General for Evaluation and Inspections. First, I'll highlight our report, which responded to a congressional mandate to examine the effectiveness of enrollment procedures and safeguards. Then I'll talk about our companion report, which addressed a specific risk area, the inconsistency resolution process. Our mandated work examined and directly tested internal controls at the federal, California, and Connecticut marketplaces. These controls related to verifying the identity of applicants and application information, determining eligibility of applicants for enrollment in qualified health plans, and maintaining and updating enrollment data. Our period of review for that report was October through December of 2013. We concluded that the federal, Connecticut, and California marketplaces had certain procedures in place to verify an applicant's information. However, not all internal controls were effective. The presence of an internal control deficiency does not necessarily mean that applicants were improperly enrolled in health plans or in insurance affordability programs. Other mechanisms exist that may remedy the internal control deficiency. These deficiencies in internal controls may have limited the marketplace's ability to prevent the use of inaccurate or fraudulent eligibility information. We recommended in this report that CMS and the Connecticut and California marketplaces take actions to improve internal control deficiencies. These include verifying the applicant's identity, determining the applicant's eligibility, and maintaining enrollment data. For the companion report, we analyzed from a national perspective how marketplaces resolved inconsistencies between applicants' self-attested information and other data sources. We obtained data from the state marketplaces from October through December of 2013, and for the federal marketplace, we analyzed data through February of 2014. During those time periods, many marketplaces were unable to resolve most inconsistencies. Most common were related to citizenship and income. The federal marketplace was unable to resolve 2.6 million of 2.9 million inconsistencies because the CMS eligibility system was not fully operational. The ability to resolve inconsistencies varied across the marketplaces. 7 state-based marketplaces reported that they were able to resolve those inconsistencies without delay. Now, inconsistencies do not necessarily indicate that an applicant provided inaccurate information, nor do inconsistencies equate to errors in enrollment in health plans or insurance affordability programs. However, marketplaces must resolve these inconsistencies to ensure eligibility is accurate. So accordingly, we've recommended that CMS develop a plan for resolving the inconsistencies in the federal marketplace. We also recommended that CMS ensure that inconsistencies in state-based marketplaces were resolved according to the federal requirements. These are the first two reports in a series related to operations of the marketplaces. We have a substantial body of work underway and planned to ensure that taxpayer dollars are spent for their intended purposes in a system that operates effectively and is secure. This work will examine additional critical issues related to eligibility systems, payment accuracy, contract oversight, data security, and consumer protection. So I want to thank you all for your interest and support for the OIG's mission and for the opportunity to discuss our work today. We're happy to answer any questions you may have.
Chair thanks the gentlelady for testimony. We'll now begin questions and answers, and I'll recognize myself 5 minutes for that purpose. Ms. Daly, on January 1st, 2014, Secretary Sebelius certified to Congress that the exchanges are verifying eligibility. Federal law required this certification before exchange subsidies could be made available. OIG's report states, quote, as of the first quarter of 2014, the federal marketplace was unable to resolve about 2.6 million of 2.9 million inconsistencies because the CMS eligibility system was not fully operational, end quote. Based on these facts, isn't it true that HHS made this certification to Congress before the eligibility system was fully operational?
Well, Chairman Pitts, we, of course, looked at the Secretary's report purely for informational purposes and didn't really analyze it to understand more about what was behind that, what the Secretary had available for making that certification. So I really can't speak directly to your question. I'm sorry.
Although your statement says because the CMS eligibility system was not fully operational. Do you stand by that statement?
Oh, absolutely, sir.
All right. Has CMS provided the OIG a firm timetable when their eligibility verification system will be fully operational?
No, sir, not to my knowledge.
Is it possible that these inconsistencies will not be resolved by the next open enrollment period, which starts in November of 2014?
Well, we have work ongoing in that area right now, but I really don't know about any definite timetables nor when they may be fully operational at that time.
Ms. Greenleaf, did you want to add to that?
I would add that in CMS's comments to our report, they indicated that implemented an interim manual system to address the inconsistencies that they were unable to address during the period of our report. And CMS said it would, reported to us that it would have an automated system by the end of the summer. We have not followed up as yet, but we do have a tracking system in place to monitor the implementation of the recommendations.
Thank you. The OIG is focusing on several areas of work to conduct oversight over spending under the Affordable Care Act. Understanding that much of the scope of the work is fluid, can you highlight some of the specific areas of work your office intends to focus on?
I'd be glad to do so, sir. Our office has embarked on a strategic approach to looking at the marketplaces, and we've developed a strategy we refer to as PECS, and that stands for Payment Accuracy, Eligibility, Contracting, and Security. And with that, we have a number of work planned and already underway looking at payment accuracy. How accurate are the payments that are going out to insurers, and also we are starting work looking at payments, within the context of providing subsidies and things of that nature. Further, with our eligibility work, this is just the first and other jobs that we have planned and underway to look at eligibility. We've started work at other state-based marketplaces to understand what, their systems were, and doing additional work at the federal marketplace also. For contracting, we're looking at several aspects of the contracting that was involved in development of healthcare.gov. And then finally, with security, we are looking at the information security that's designed to protect the information in these marketplaces.
All right. The OIG report states that the administration did not have effective controls in place to perform basic tasks. Can you elaborate on this and tell us what HHS has done to date to alleviate this problem? Either one of you.
Right. Well, with that, I'd be glad to talk about some of the issues that were in our mandated report. For the federal marketplace, we found that some Social Security numbers were not always validated through the Social Security Administration. And CMS has advised that they are, following up on these issues and trying to identify any particular issues that were causing that from a systemic approach. With that, there were the inconsistencies in eligibility data that we had talked about, and we've already identified. They had said they had put in an interim system and were continuing to address those inconsistencies, and that a more formal process will be in place later. Last, we saw that there was not the system functionality to allow enrollees to update their information that was in the system. CMS advised us in agency comments that they had taken steps to allow the functionality so that that information could be updated. So we've not had a chance to go back and look at how well that is functioning at this time.
Ms. Greenleaf, can you elaborate a little more?
I would just reiterate what I said previously regarding the inconsistencies. That was the priority concern in the report, that dealt with the inconsistencies, and we called on CMS to fix that and make public a plan, and we'll be monitoring their response to that through our formal tracking system.
My time's expired. Chair recognizes the ranking member, Ms. Pallone, 5 minutes for questions.
Thank you, Mr. Chairman. It's not a surprise anymore that my Republican colleagues never want to talk about the good news with the Affordable Care Act. 8 million signed up for private plans, 6.7 newly enrolled in Medicaid, 3 million young adults on their parents' plans. The list goes on. For years now, the GOP have ignored the financial assistance available through the marketplaces. They put out misleading analysis claiming massive premium increases, and they've never once admitted that the vast majority of enrollees will qualify for assistance and that coverage will become extremely affordable. But here are some facts. This year, tax credits cut the average enrollee premium by 76%. The average premium consumers are actually paying for dependable comprehensive coverage is $82 per month. 70% of people getting financial assistance pay less than $100 a month. 50% pay less than $50 per month. And this is incredible news, and that's why the Republicans, of course, don't want to talk about it. Instead, they claim there's widespread fraud in who's getting the financial assistance. And the reports our witnesses are discussing today address the eligibility checks on the front end. And as we've heard, an inconsistency does not necessarily mean an individual is getting an incorrect subsidy. So I'll say, Ms. Greenleaf, but whoever can answer, isn't it correct that your report states, quote, inconsistencies do not necessarily indicate that an applicant provided inaccurate information or is enrolled in a qualified health plan or is receiving financial assistance inappropriately?
That's correct. Inconsistencies can occur for both eligible and ineligible applicants.
And thank you. An inconsistency on an application should not be a surprise. Automatically checking dozens of pieces of application data against a variety of federal databases is not a simple thing. In fact, a family of 4 could generate 21 different inconsistencies on their application. And that's why the lead contractor responsible for resolving these inconsistencies said he was not surprised by the number of inconsistencies. If a consumer includes a hyphen in their name on their application, which does not appear in federal databases, that could generate an inconsistency. If a consumer had recently moved, that might generate an inconsistency. But those are clearly not examples of fraud or misrepresentation. They are harmless. Similarly, with regard to income, the marketplace checks individual income off of 2012 tax data, so it would not be a surprise if their 2014 income data was different than 2012. Again, Ms. Greenleaf, isn't it true that an income inconsistency does not necessarily mean an individual is getting too much or too little financial assistance?
It doesn't necessarily mean that, no. As I mentioned previously, both eligible and ineligible applicants can have inconsistencies, and the law anticipated the existence of inconsistencies. What's concerning is the number of unresolved inconsistencies.
Okay. Now, again, CMS has resolved more than 460,000 inconsistencies and has a process in place to resolve the remaining inconsistencies this summer. So, Ms. Greenleaf, CMS concurred with your recommendation to make public their plan to resolve inconsistencies. Isn't that correct?
We have not received CMS's official response outside of what's in the actual report yet. So they have a certain amount of time to respond to the recommendations officially. In its comments to our report, they did indicate the interim manual system and later this summer to fully automate. So we will be monitoring that closely through our formal tracking system.
And isn't it correct that in their response to your recommendations, they wrote, and I quote, "The FFM now has in place an interim manual process that allows it to reconcile inconsistencies and plans to implement the automated functionality this summer."
CMS did say that in its response to our report.
I'm just pleased that the IG is monitoring the agency's work, but the progress CMS has made to address these issues is important. And I guess, you know, look, I am just so frustrated by the fact that the Republicans are ignoring all this in order to score political points. I mean, again, we're talking about middle-class people here. We're talking about someone who's trying to fill out a form. We're talking about people whose income is, what, $25,000, $30,000 to $80,000 or $90,000 for a family of four. This is the middle class that supposedly all of us want to build and provide a decent health care benefit package for. I'm not saying we shouldn't have the hearing, obviously, but I just think that there's so much emphasis on the GOP side on the fact that some, you know, average person is going to commit fraud. And, you know, that's not the case here. This is not a huge problem that's being presented. But thank you, Mr. Chairman.
Chair, thanks to the gentleman. Now recognize the gentlelady from North Carolina, Mrs. Elmers, 5 minutes for questions.
Thank you, Mr. Chairman, and thank you, Ms. Daly and Ms. Greenleaf, for being with us today. You know, when your study shows that 85% have not been resolved, I mean, that's an incredibly large number of applicants that are, you know, application process that's in question, and that certainly doesn't mean that there was fraud perpetrated. It just means that there are inconsistencies, and those inconsistencies need to be addressed. And it goes to the larger problem of eligibility and how are we ensuring the American taxpayers, you know, their hard-earned dollars are being utilized to the best possible. We want to see everyone have affordable health care. We need to make sure that it's done right. And, you know, starting at this point is a good place. So I guess what I need to know is, what happens now? I mean, what happens? I know that you said, Ms. Daly, you talked about a formal tracking system going into place, which that's very, very good. Making sure that payments that are going out are accurate and being accounted for. But then, you know, in relation to those who might be in that situation of getting subsidies that might not have qualified, how can we address that issue? I'm glad that there's a tracking system in place for the payments, but how is that going to help us, you know, get to the bottom of the issue? And Ms. Greenleaf, I would like for you to weigh in as well, if you'd like.
Well, thank you very much for that question. I think the inconsistency periods, that was set up, you know, as part of the law and the regulations surrounding ACA, because indeed there can be some variations in some of the information. So it gives an opportunity to try to clarify all that. During that period, people are conditionally enrolled in the program until that is cleared up. I think the rules state that if there does turn out to be a case where perhaps someone may have gotten a subsidy that they were not entitled to of whatever nature, financial assistance of whatever nature, there are, you know, plans in place for obtaining resolution on that. So that, you know, for example, with the tax credit, would be worked out, you know, when the consumer files their tax return, you know, next year, and this is all supposed to be reconciled at that point in time.
How would it be reconciled, though? Because basically, aren't they paying a certain premium amount or getting a certain tax credit at that level? How would because would they or would they not be paying more for their health care coverage if there is an inconsistency that's found to be, accurate, essentially meaning that they did find the inconsistency, and then someone is, how do you make up that difference? Ms. Greenleaf?
I think that happens, it's my understanding, through the reconciliation process with the IRS. So it could be that some applicants would be owed money and others would in fact owe money. So it could be determined either way. They can lawfully enroll during the 90-day inconsistency period, after which a redetermination is supposed to be made. But
Okay. And then I guess there again, from what you're saying, the IRS then becomes the enforcing body that will make sure that this happens.
That's my understanding, yes.
Okay. Well, thank you. And I really, Mr. Chairman, I don't have any more questions, so I yield back the remainder of my time.
Chair thanks the gentlelady, and now I recognize the gentleman from Texas, Mr. Green, 5 minutes for questions.
Thank you, Mr. Chairman and Ranking Member Pallone for our witnesses for their testimony today. I want to start by echoing my colleagues. Inconsistencies are not the same as errors or fraud. It is incorrect and deliberately misleading to refer to them that way. According to John Lau, Vice President of Serco, the contractor responsible for obtaining the necessary information to address enrollment inconsistencies, 99% of the inconsistencies in marketplace applications are innocuous. It's also disingenuous to suggest such consistencies are specific to the Affordable Care Act. Federal and state programs where eligibility must be verified, such as Medicaid, all face the challenges of reconciling inconsistent data and applications. However, in Medicaid, eligible applicants are put on a waiting list while the discrepancy is sorted out, forced to go without health coverage for however long it takes. Under the ACA, Americans can enroll and get coverage immediately. The inconsistencies, which I repeat, are 99% innocuous in ACA applications, are going to be resolved at some point. But we feel it's better for people to get coverage after applying instead of going on a waiting list indefinitely. Ms. Daly and Ms. Greenleaf, other federal programs have to verify individuals' eligibility through application process. Isn't this correct?
Yes, sir.
Okay. So inconsistencies in applications are not unique to exchanges created under the Affordable Care Act.
Yes, sir.
Okay. Thank you. In the Medicaid program, eligible applicants are put on a waiting list until their inconsistency is fixed and applicant can access coverage. That's partly why we have a massive backlogs in Medicaid applications in states around the country. That's not a solution at all. Given the unknown nature of health care, you never know when you will need it. It's long overdue that we move beyond efforts to undermine, repeal, or create unwarranted alarm for a political game about the ACA and get back to the business of serving the American people. I have time left. Can you give me examples of other programs that maybe the GAO has investigated that you go back in and have inconsistencies?
I'm sorry, but just nothing is coming to mind at this point in time, but I'd be glad to get back with you on
Okay, if
that.
you would, and
Yes.
share it.
nothing comes to my mind either.
Yeah.
Thank you. We can get back to you if we identify anything.
Were there any specific recommendations that either of your agencies made to Health and Human Services to correct some of the problems?
In our report, sir, we had identified a number of weaknesses at both the federal, Connecticut, and California marketplaces, and we made specific recommendations to fix the underlying systems, of course, that were prompting, such errors. And then we also asked them to fix the specific cases that we had found. And they were generally amenable to doing so, so that was very helpful.
Have you followed up with that to see both on the national exchange and the Connecticut and California if that is what they're doing, if they agreed to correct those inconsistencies?
Yes. Well, we do have work that we're getting underway right now to do additional work at the federal exchange to look at some other issues there, and plan as part of that to do additional follow-up on the status of the recommendations we had made in this report.
Okay, so this is not something that we're going to sweep under the rug. We want to deal with it because, again, the ACA is a valuable tool for people in our country to get health care, and we want to make sure it's done right. and I appreciate your agencies for doing that. And hopefully Congress will get back to what we want to do, is make sure it gets done right. Mr. Chairman, I'll yield back my time.
Chair, thanks, gentlemen. Now recognize the gentleman from New Jersey, Mr. Lance, 5 minutes for questions.
Thank you very much, Mr. Chairman. This committee has spent a great deal of time and effort discussing the inadequacies of the health care law's rollout. Some people believe that the worst is behind us, and many of the most important serious problems have been resolved.
Well, yeah.
However, I believe, as your report has pointed out, many of our constituents may be in for a rude awakening when their tax bill comes due. I'm also greatly concerned, and this is not an area for you to address, but I wish to place on the record the fact that there is the significant constitutional and statutory issue regarding subsidies for the federal exchange as opposed to subsidies for the state exchanges. That issue will be resolved in the courts. I did ask Secretary Sebelius about that very significant matter at a previous hearing, and let me predict that that case is likely to go to the Supreme Court, although it's now in the various circuits. Regarding the issue this morning, it is my understanding that you did not review certain eligibility issues because you did not have access to federal taxpayer information at the time of your audit. Would you please update the committee on your access to that information now? Ms. Daly.
Yes, sir. Yes, as we were performing our work, we learned that you could not have the access to the federal taxpayer data. So we immediately began to discuss the issue with IRS and have worked very closely with them. They've been very agreeable in helping us sort through the issues. At this time, we have been advised that we can access the federal taxpayer information that is provided to the federal marketplace. And so that's going to be one of the key areas we're following up on to do the similar work that we had done looking at other aspects of determining eligibility, to also look at the, verifying the income. And with that, we are also continuing to discuss with IRS obtaining access to the state marketplaces too.
And does either of those matters require statutory change, or can you do that administratively?
Mm-hmm. Well, to date, we've had success in doing that administratively, but if it looks like we may need to have a statutory change, we'd be glad to get back and work with you and your staffs to try to bring about such a change.
Do you have a time frame, Ms. Daly, when you will receive that information regarding both the federal exchange and the state exchanges with the IRS?
Yes. Well, for the federal exchange, we have received the authorization to go in and review that. We're just going through some more logistic issues of ensuring that we have appropriate safeguards in place to protect that taxpayer data while it is in our possession. And for the time frame, let's see, for completing the work on the federal exchange, I believe it's in the spring of 2015, we should have the results out on that assessment there. And with the states, we're continuing to work with them, so I can't provide you with an assessment right then of when that may be available.
Thank you. I hope you're able to provide us with that when you do get that information. Regarding the fact that the federal exchange information with the IRS may be available in the spring of 2015, next spring, I wish to make sure that my constituents understand the implications of these problems that were highlighted in your report. If the eligibility verification system produces a determination for an applicant with an inaccurate exchange subsidy, am I accurate that the IRS is required by law to claw back that money from the individual?
Sir, if you're referring to the tax credits and so forth, yes, sir, that would be part of the IRS's responsibility. And I'd also like, if I could, to take a second to clarify that our work that we plan to be doing at the federal exchange, that's when we would have completed the work, would be in the spring of 2015, so we can provide the results at that time to the august members of this body.
Thank you. I'm not suggesting necessarily that there is fraud on the part of those who may have provided inaccurate information. I would imagine in most cases it's not a matter of fraud. It simply may be a matter of inaccurate information, and all of us as human, we all make mistakes. I do believe that there is a potential that there's going to be many unhappy surprises come tax time next spring in the spring of 2015. Only time will tell, but certainly that impresses me as being a possibility. Thank you, Mr. Chairman.
Chair thanks you, gentlemen. Now recognize the gentlelady from Illinois, Ms. Schakowsky. 5 minutes for questions.
Thank you, Mr. Chairman. I have a statement and a request to make. I hope I'll still have time for some questions. But we've had a lot of good news about the Affordable Care Act in recent weeks. 8 million enrolled in private coverage, 6.7 million enrolled in Medicaid, the number of uninsured dropping by 10 million people, and the rate of uninsured in states around the country dropping by 30, 40, even 50% in just 1 year. Actually, that's pretty amazing. And I want to put 2 articles in the record that discuss some of this good news and what I believe is the warped Republican reaction to it. The first is a column in the New York Times. The columnist writes, quote, "What you get whenever you suggest that things are going okay with the ACA is an outpouring not so much of disagreement as of fury. People get red in their face, angry, practically to the point of incoherence over the suggestion that it's not a disaster," unquote. He goes on to say, quote, "I suspect there's now an element of shame if this thing is actually working. Everyone who yelled about how it would be a disaster ends up looking fairly stupid," unquote. The next piece I want to highlight is from health reporter Sarah Cliff, who listed out, quote, 7 predicted Obamacare disasters that never happened, unquote. Here's the list. 1, the website will never work. 2, nobody wants to buy coverage. 3, the ACA would not meet enrollment goals. 4, only people who already had coverage are signing up. 5, there would be a net loss of insurance. 6, premiums will skyrocket. And finally, 7, that the law just won't work. People won't get doctor's visits, insurers will drop out, etc. And Mr. Chairman, each and every one of these predictions has proven flat wrong. 10 million people have gained coverage this year because of the ACA. Surveys indicate that they like their coverage. There are none of the increased wait times or skyrocketing premiums. Republicans claimed, especially when you factor in the financial assistance that is that's available. More and more insurers are participating in the marketplaces next year, increasing choice and competition. So, Mr. Chairman, I would like to put these 2 articles in the record.
Without objection, so ordered.
Thank you. You know, and I just want to say about this hearing, if this were a good faith effort to really find and fix some of the problems that are in the Affordable Care Act, I'd be more than happy to fully participate in every way in those kinds of efforts. Anybody knows that such a ambitious piece of legislation is going to have to be tweaked. I don't think anybody would disagree that there aren't ways that we could make this better. But time after time in this committee, what we do is look for ways to simply attack the law, suggesting that it is just horrendous, it's unworkable, when we know that it is helping millions and millions of people. 74% of Republicans who have signed up said they like that. You know, I would say that's pretty good. I mean, you know, there's still, you know, a quarter of the people who say that they're not happy. Let's figure out why and try and make that better. But I don't feel like this is the spirit of these hearings. We're talking now about lawsuits that are going to go to the Supreme Court. We could, as a Congress, as a committee, address some of these problems and actually suggest changes that we could vote out and then present to the full House of Representatives and make those things better and work. So it's just, you know, our ranking member expressed frustration, and I feel that too. You know, I ran, the reason that I'm in public service is because my hope was that at the end of my career I could say that I helped provide health care to all Americans. What could be more basic than wanting to do that? Is that really what my colleagues across the aisle are looking for, or is it to nitpick and ultimately sue? I mean, I think about this lawsuit that is being considered today. We're talking about the president being sued for not enforcing the Affordable Care Act, that hated law by the Republicans for not enforcing it fully. And for not enforcing, they're saying, a provision that perhaps was the most hated, the employer mandate. So I'm just really, really confused. I'm sorry. I appreciate the witnesses. I appreciate that you're looking into these problems and trying to help us solve them. That ought to be the goal of all of us here, and I yield back.
Chair thanks the gentlelady, and now recognize the gentleman from Kentucky, Mr. Guthrie. 5 minutes for questions.
Thank you, Mr. Chairman. I thank the ranking member, and I thank the witnesses for being here today. You know, it's not just providing the information that has to be checked as well. I've heard from multiple groups that represent employers that haven't been notified a single time by CMS as required by law that an employee has received an advanceable premium tax credit. And I understand the process is supposed to work is that CMS should be verifying upfront whether the employee has access to affordable coverage prior to authorizing a subsidy. And to me, this step is critical. As we know, certain coverage offered by an employer would make individuals ineligible for tax credits. Did you see this process, how this process was working? Or was it working? My understanding, people aren't being contacted to verify, employers not being contacted to see if they offer affordable coverage.
Well, yes, sir. That was part of the audit work that we did in performing our tests. And as part of that, of course, it varied across the marketplaces how that worked. For the federal marketplace, they were checking, other federal organizations such as to determine whether there was coverage offered with OPM, with the Department of Defense, and other places that offer health insurance. For other cases, there would be attestation, bringing in information from the employer to do that check itself.
Is that happening as the way it should be happening?
Well,
I know what's supposed to happen. How is it happening? Yeah, I'm sorry.
No, perfectly fine. No, that is actually how it's happening now, because the issue is that there's no national database in which you could quickly go check. So that was the approach that was taken.
Well, the problem is if it's done inaccurately, then employers, as a couple of my colleagues have said, then employees will be receiving thousands of dollars in inaccurate tax credits, and they'll be required, as we established earlier, to pay back. Mm-hmm. So there could be people. I read the report too. I went through the report, and I understand what you're saying. They were trying to make this provision work, but it doesn't seem to have a good way to do it, and therefore we're going to have people being ineligible to receive credits they're receiving. They're going to have to pay it back, and they're going to, like I said, not in any malice are they doing it. They're just following. Hey, I can sign up for health care. I've heard it on the TV, radio. If you're in Kentucky, sit on billboards, and they go sign up. And if it's not verified, then later on they'll have to pay back. And like I said, they're not doing it on purpose, but that can happen to them. And it's a lot of money to have to pay back at one time when they find that. So I just, as we move forward, I guess, you're doing further tests. I think that's an area we really need to look at. Do you have, Ms. Greenleaf, any comments on that process?
I don't have anything to add to that.
Okay. Well, thank you, and I'll yield back.
Chair thanks the gentleman. Now you recognize the Vice Chair of the full committee, Ms. Blackburn. 5 minutes for questions.
Thank you, Mr. Chairman. I want to thank you all for being here. We've got an interesting hearing going on downstairs also, as you all are probably aware, with the problems with the HHS CDC labs, etc. So I've been back and forth from that. I think that as we talk about this verification system, it is important to remind everybody that Secretary Sebelius on January 1, 2014, verified that the exchanges were indeed verifying eligibility. And while the Secretary certified a verification system, there is still no real system in place. And even HHS, the watchdog, reports that the administration does not have effective controls in place to perform basic tasks such as validating Social Security numbers, correctly identifying applicants, and verifying citizenship. And again, this has not been corrected. So for some of us who have lived through some of the government-run healthcare programs, and for Mr. Pallone's benefit, I always have to bring up TennCare because it thrills him when I bring up TennCare and the failed experiment in Tennessee with government-run health care. And if Congressman Green wanted examples of inconsistencies in how they were not dealt with, I can give him a laundry list. And so I'm sure Mr. Pallone will have him come talk to me about those. But I find it so curious. And Ms. Daly, I'll come to you. You know, how do you certify a verification system when there really isn't a verification system in place? And what are the detailed step-by-step components of this verified, certified verification system?
Okay. Well, with that, the Secretary, was responsible for providing such a certification on the report. I'm sorry, on the system that was in place, and did indeed provide one. Now, we haven't reviewed that report in detail. We did use it for informational purposes to learn more about the, the regulations and law and so forth that was in there. But so I can't really speak to what the Secretary relied on or used for making
Well,
such a
let me
certification.
ask you this, Ms. Greenleaf, does it make sense that you would certify a verification system when you didn't have a verification system?
I'm not familiar with the process that the Secretary used to take a look at that system.
So what you're telling me is that there is no standard operating procedure, or there are no benchmarks, there are no written expectations for what the system will be. Is that correct, Ms. Greenleaf?
I'm not familiar with what the benchmarks or systems for operation would be for that.
Ms. Daly?
Yes, Congresswoman, I apologize there. Yes, there are regulations that are in place that, have went through the full vetting process that all federal regulations go through, for determining what's appropriate to have in such a system. They, it's helping design the system.
Okay, so you've got regulations.
Mm-hmm.
Do you have a plan for a full end-to-end system for verification processing?
There was a plan that was put in place for determining the,
Is
the
it
system.
active and operational?
Well, there is a system that is operational at this time. There are
Is it functioning?
Our report identified that some of the controls in that system weren't functioning as they were planned to do so within the regulations. Some were, some were not.
Okay.
Mm-hmm.
So still, they don't have their verification processes in place end to end.
That would be fair, yes, because we
Okay.
identified some that weren't operating as they should at that point in time.
So as long as we have that failure, that systemic failure, we cannot certify that the subsidies are working appropriately, and people that are receiving taxpayer money, and this is something I think everybody needs to remember. This is not federal government money that is making the subsidies. It is taxpayer money that is sent to the federal government by hardworking taxpayers that is going into these subsidies into a system that does not have a verification process in place end to end. In Tennessee, when it didn't work, Democrat governor had to come in and remove 300,000 people from the program. 300,000. Now you say that times 50, and you see the problems we're going to be up against because we don't know who's getting the money. I yield back.
Chair, thanks, gentlelady. Now I recognize the gentleman from Virginia, Mr. Griffith, 5 minutes for questions.
Ms. Daly, I'm going to pick up a little bit where Ms. Blackburn left off, and appreciate her questions. The administration, when dealing with criticisms about the implementation of the website, likes to come back and say, well, it's better now. And in October, they did not have a fully operational back-end eligibility system. And yes or no? Based on your testimony here today, it sounds like to me they do not currently have a fully operational back-end eligibility system. Isn't that correct? Yes or no?
Well, it depends on the time. The time frame that we looked at covered the period through December of 2013. So that's what we focused on.
Okay. But you indicated that some were working and some weren't, but right now, it's not working right now completely. Isn't that correct?
I can't speak to what's working right now, sir. I'm sorry.
All right. But if they did have a system, you wouldn't have expected a document from CMS to have been released last month indicating the number of individuals enrolled in the exchange plan. And when the committee received that document, if you could read the part, I believe it's been given to you or Ms. Greenleaf on page 3 of that document provided by CMS to the committee. And that last statement says, if you would read that for us, please.
Yes, sir, I did receive that document, and just wanted to acknowledge that I've not had a chance to analyze this, and these aren't the IG's data by any means, but I'd be glad to read it for you.
Yes, ma'am.
Current data indicates that 2.1 million people who are enrolled in a qualified health plan, or QHP as it states on the document, are affected by one or more inconsistency.
All right. Now, if there was, in fact, a fully operational back-end eligibility system on January 1, we should not have this problem. Isn't that correct? Yes or no?
Fully out, yeah.
On January 1.
I would say that that would be a fair statement, that we would have, you know, a fully operational system on January 1, and our work showed that that was not in place.
That was not in place. And so then when Secretary Sebelius certified to Congress that system did in fact work, she would have been mistaken. Isn't that correct?
I really can't respond to that.
Okay. I'm not asking you whether she was doing anything intentional or whether she was given bad information. I'm just saying she said it worked. It didn't work. You know it doesn't work. Therefore, she had to be mistaken. Isn't that correct?
Well, I think the issue is that
It's yes or no. Either she was mistaken or she was correct. If she was correct, it worked fine. You've already told us it didn't work fine, so the answer should be yes, shouldn't it?
well, I think
I know you don't want to say she's mistaken, but wasn't she mistaken?
Well, I have to read very carefully how that certification was worded, and quite frankly, I have not done so.
All right. That being said, let me take a minute, Mr. Chairman, if I might, to respond to some of the things that were said earlier about the Obamacare not being a disaster. My constituents feel it is a disaster. Let me go through a few of the things that were raised in the point by the gentlelady previously. Talking about the suit for the president, she indicated that we were suing the president for not going forward with Obamacare in parts that we didn't care for. While that's true, the real reason for the suit is that the president is not faithfully executing the laws passed by Congress. Whether I like the law or not, the president ought to execute the laws passed by Congress and not suspend the law and then reinsert his own legislation into that. Further, I would say, Mr. Chairman, she said that, you know, we could fix it. I would submit that Dr. Frankenstein couldn't fix his monster. We're not capable of fixing Obamacare. For people who, she said that premiums are not skyrocketing. I don't know about her district, but in my district, people are finding that their premiums are going up at a substantial rate. They would tell me, and they do on a regular basis, that it is in fact skyrocketing. And then, you know, she said that it was working. Look, for my folks, and I represent what I call the cornucopia of Virginia, that part that comes out of the deep Southwest and spills out into the rest of the state. We border the states of North Carolina, West Virginia, Tennessee, and Kentucky. We have split cities in two: Bluefield, Virginia, West Virginia, Bristol, Virginia, Tennessee, where the main commerce street is State Street, and the line is right down the middle of the main street of commerce. But you can't go to a hospital if you live on one side of State Street that's more than one county out if you're in the Obamacare plan. You can't go to a hospital in West Virginia. You can't go if you live in Martinsville or in Galax, Virginia. You can't go to Bowman Gray in North Carolina or Duke any longer. You want to say a system is working when people have been able to go to teaching hospitals in the past and now they have to drive a lot further to get to one because of Obamacare? It's not working. I submit that the gentlelady in that case was wrong as well, and I yield back.
Chair, thanks, gentlemen, and now recognizes gentlelady from Washington, Kathy McMorris-Rogers, for 5 minutes of questions.
Thank you, Mr. Chairman, and I appreciate you both being here today. I wanted just to reinforce before I went to my question that the administration didn't make a pledge to prevent fraudulent payments. The law states that only certain individuals are able to qualify for subsidies and that they must be able to prove citizenship. And it's just another example of the administration ignoring the rule of law. My questions. First, the Secretary has refused to release any more enrollment reports after the one they released in May. Do you think continuing the issuing of these reports to Congress and the public would be helpful?
I'm not certain that the Secretary is compelled to do so under any law or anything of
Do you think it
that
would be helpful?
I think it would be helpful.
Okay, thank you. After your analysis of the federal marketplace and the 2 state marketplaces, do you think these exchanges are able to start reporting on who has actually been paying their premiums?
Oh, well, I'm sorry, I'm not positioned to answer that at this time on the current status of what's going on at the marketplaces.
Do you know how soon we will have a sense as to who is actually paying their premiums in these exchanges?
Well, we do have a variety of work that's planned and underway looking at further operations of the marketplaces. But I think we're going to be looking at the state marketplaces. We've already got that work started on the ones we had not already reviewed. And that work is going to be coming out probably sometime in the winter and spring of next year. And it's going to be, because there are quite a few, there's a number of reports that will be coming on that.
Is it the goal to better clarify actually who's been paying premiums and not? Is that going to be part of the goal?
Well, I think who's paying the premiums on the insurance, we are looking at this time at how the premiums that are being paid, if they're going to the right insurers, you know, but whether the insuree, the person that's gotten the
right.
insurance, is making their premium payments is not an issue that we had focused on at this time, but we'd be glad to work with your staff to understand more about, you know, some of the implications surrounding that and to see if we can, you know, get the resources to work that into our work plan.
Now, I know that your report focused on the federal marketplace and the state marketplaces in Connecticut and California. However, I represent Washington State, and I was curious as to the extent of OIG's office and their monitoring of the state exchanges beyond California and Connecticut. Recently, the Washington Health Plan Finder, that's our exchange, had to explain to customers why some of them received an August invoice for twice the amount they owed. Now, you think about the impact on the middle class and the uncertainty that they face and the confusion that they continue to face and whether or not they're paying double their premiums or not. Others received no invoice, and some received an invoice with a 0 balance, even though they owed a monthly premium. So, are there procedures in place in Washington and other state marketplaces to quickly remedy these types of errors?
Unfortunately, our work hasn't looked at that particular issue at this point in time. You know, so I'm sorry I can't respond directly to your question.
Well, is the Office of Inspector General ever going to look at this question as to who's actually paying these premiums and whether or not it is accurate? These are hardworking middle-class families quite often that are in need of health insurance, are trying to, you know, figure out how to stretch their paychecks to pay for oftentimes increasing premiums. Are we ever going to assure them that they're actually paying accurate premiums, or how are we going to address when there's a double bill and those kind of issues?
Mm-hmm. Well, those are important issues, and again, we'd be glad to work with you and your staff to help see if we can design some work that would be able to address those areas of concern.
So, my final question, what's going to happen to someone when they are either confused or they accidentally don't pay? Or if they pay double? Whatever the situation, are they going to be cut from coverage, or will they receive a refund? How is this going to be remedied?
Mm-hmm. I'm sorry, if you could just help clarify for me.
Okay, my question is, you're an individual.
Yes.
You've either been charged double, or maybe you accidentally didn't pay, and how is this going to be remedied?
Right. Well, I'm just not positioned to respond to that today simply because our work hasn't focused in that particular area as yet, so.
Is there a plan to ever address these questions?
Yeah, I'm just sorry, I just don't have any information available for you at this time, but we'd be glad to try to get back with you on that.
And the weeks go by and individuals are out there still looking for answers too. Thank you, Mr. Chairman.
Chair, thanks, gentlelady, and I recognize the gentleman from Georgia, Dr. Gangry, 5 minutes.
Mr. Chairman, thank you. I haven't been here for the entire hearing because we have one going on concurrently downstairs, very important as well. But the little bit that I've heard since I've been here really disturbs me. My term in Congress, my 12th year, my 6th term will come to an end at the end of the 113th Congress. I'm looking for something else to do, and I think I'm going to apply for a job as an Inspector General in the federal government because the hours seem good and obviously there's no heavy lifting. Your responses so far, both of you, have indicated to me that you don't seem to really be on the ball in regard to Inspector Generaling in a non-biased, unbiased way, which is what you're supposed to be doing. And when I talk to people in the 11th Congressional District of Georgia, there's no way that I can give them any confidence that you're doing your job so that people who are undeserving, unqualified to receive part of the $1 trillion worth of subsidies in this ultra-expensive program are getting to the right people. So let me specifically ask you, and you can comment on my comments as well. But OIG's work has revealed a number of problems, as I've heard this morning, in CMS's process for verifying whether an individual is eligible for part of the estimated $1 trillion in exchange subsidies that will be spent over the next 10 years. And I'd like to ask if OIG has found problems in resolving inconsistencies in the following areas: an applicant's Social Security number, an applicant's legal status, an applicant's income, and all these income set-asides that exist by virtue of waivers in the Medicaid program and everything across the various and sundry 50 states and territories. Other sources of coverage for an applicant, such as employer-sponsored income. Can you give us a little insight on any of that? And for goodness sakes, isn't that what you're supposed to be looking at?
Thank you for the question. In fact, when we looked at the marketplaces, we did find problems with their abilities to resolve inconsistencies in all those areas that you identified. The most common inconsistencies that were not resolved did concern citizenship and income. You had also mentioned Social Security number. There was some ability of the federal marketplace to resolve those, but in the end, the marketplace resolved very few. These inconsistencies don't necessarily equate to an improper enrollment or an improper subsidy, but they are concerning, and we made recommendations that CMS resolve these and make its plan public on how and when it will do so.
Well, have they made that public? You made the recommendations that they do so, but as far as you know to this point?
We're tracking their response. In their comments to our report, CMS indicated that it had implemented a interim manual process to resolve inconsistencies and was making progress, and we will be following up with them in a formal way to track their responses over the next couple of months.
Well, I don't have any other questions. Ms. Daly, did you want to respond to that as well?
No, sir, but thank you for the opportunity. I think Ms. Greenleaf did a fine job.
Well, yeah, she did okay. You know, honestly, Mr. Chairman, I think we would have done well this morning to have somebody from GAO here as well to tell us what kind of job they think the Office of Inspector General is doing in regard to this program. Look, I'm not picking on the witnesses. I mean, this is an opportunity for us to get information. There are people out there that need and deserve these subsidies that, after all, the PPACA was put in place for the supposedly 15 to 20 million people who, through no fault of their own, couldn't afford health insurance. because of low income. And yet, if we got people gaming the system, other people are suffering because of it. They're not on the program maybe. And then those that are not eligible for a subsidy, it just simply means that their premiums, their deductibles, their copay are going through the roof. And they're just going to throw up their hands and say, I'm not going to buy into this system. I'll pay the fine and go bare. And I, as a physician, know how bad that is. We don't want that to happen. So that's why I'm being a little hard on the witnesses, but I don't think too hard. And I thank them for being here this morning. I yield back, Mr. Chairman.
Chair, thanks, gentlemen. And now recognize gentleman from Florida, Mr. Bilirakis, 5 minutes for questions.
Thank you, Mr. Chairman. Much. This report of the IT issues is troubling to me. It is further evidence that this administration wasn't ready.
You want to pull your mic down a little bit?
The 2.6, thank you. The 2.6 million unresolved inconsistencies exist before the CMS's eligibility system was not fully operational. This means that people may have received a subsidy they're not legally entitled to, or people could be receiving too much. When they file their taxes next year, people could receive a shock when they have to repay parts of their subsidy to the government. I knew that the system was not going to work. I knew that it was broken. Last year, I introduced the No Taxation Without Verification Act. My bill would have prevented any tax provisions from being implemented until there was a working verification system in place. It wasn't enough that the administration had a process. They should have to meet certain metrics, in my opinion. Unfortunately and predictably, the administration made a mess of verification, in my opinion, and the entire back end of the website, just like they made a mess, in my opinion, of the healthcare.gov. Ultimately, this hurts the American taxpayer. That's the bottom line. And I do have a couple questions. In the OIG report, you recommend that CMS develop a public plan and set a deadline to clear the current backlog of inconsistencies and resolve the problems. When does CMS, this is the question, when does CMS need to have the plan and deadline released to address these pressing problems? And do you think it is necessary to provide time to test the verification changes in the system before the next open enrollment period begins?
We will be tracking, we have a formal tracking system for monitoring CMS's response to our recommendations. So that just over the next couple of months, I believe within 6 months, they have to have a formal plan back to us, though it could well be sooner.
Are you going to press them?
Yeah, we'll be following up both formally and informally. The Office of Inspector General leadership meets regularly with the CMS leadership, and this is a high priority recommendation. The bottom line is inconsistencies need to be resolved so we can have confidence that the determinations about eligibility are accurate.
Thank you. All right, next question. The OIG reports that applicants are given a 90-day period to resolve inconsistencies after a notice is sent to a consumer. This 90-day period can be extended generally by the Secretary, but cannot be extended in instances involving citizenship and immigration status. Do you know if HHS is holding applicants to this standard? Can you answer that question first?
That was a little bit outside the scope of our review, and you're correct, there is the 90-day inconsistency period during which an applicant can lawfully enroll, and the inconsistency is supposed to be resolved during that time. But we did not collect information on how often it's being extended or whether, how that's being managed at the marketplaces.
Do you have, Ms. Daly, can you respond to that?
No, sir, I'm sorry. I can't add anything to that either.
Well, I have another question, and I'd like to get this information from you immediately, it's within the next couple of days, please. Is HHS actually terminating coverage? You can't answer that. Or withdrawing subsidies if an applicant has failed to provide documentation to address an inconsistency regarding citizenship or legal status within the 90-day period? Can you try to respond to that, please?
I think we'll have to get back to you on that, try and answer that. I don't have
So
that
you're not
information. Sure. That's correct.
Is that correct, Ms.
I'm-
Daly? You're not sure?
Yes, sir.
Please
We're
get
not
back
certain
to
at
us
this
as soon as
time.
possible. This is vital.
Yes.
All right, I really would appreciate it. Thank you very much. I yield back, Mr. Chairman.
Chair, thanks, gentlemen. Now recognize the gentleman from Louisiana, Dr. Cassidy. 5 minutes for questions.
Hello, I'm sorry to have come in late, so people may have asked my questions. I apologize. Looking at your testimonial on pages 3 and 4, I gather a sample was done of California, Connecticut, the federal exchanges, a sample of 45. Now, as best as I can tell on page 4, the second bullet point refers specifically to California. Verifying citizenship, 7 out of 45, it was unclear that their citizenship was verified. I gather that's 15% of those in California who signed up. We cannot confirm that they are U.S. citizens. Is that a correct reading of this?
Yes, sir. That finding indicates that of the 45 applicants that we selected for sampling in California, 7 of those 45 were not able to, did not have their information run through the system as it was supposed to occur.
Now, I'm told that California had roughly 1.5 million people sign up through their Cover California exchange. So potentially 15% of those, or 225,000, were not citizens, potentially.
I would caution against
Accept
trying
that.
to extrapolate those results. The type of sampling that we did wasn't the type that you could use for extrapolation purposes. It was simply to provide a yes or no answer. Was the action done, yes or no?
But it was a random sample, I presume.
Yes, sir.
So as a random sample, theoretically representative of the whole, granted maybe they just didn't provide, but nonetheless, potentially as many as 15% of those who signed up through California were not citizens. Potentially. Fair statement?
Well, given the type of sampling that we
Yeah.
have done, I
There's a
can't
margin
make
of
that
error.
extrapolation. Yeah.
There's a margin of error, but nonetheless. So this being the case, wow, have you done a follow-up sample larger and more statistically significant?
At this time, we've not had an opportunity to follow up with California on this.
Now, Ms. Daly, that just seems to beg to be done. I mean, if it's potential, granted, a small sample size with a large margin of error, but if 15% of the people may not be citizens, that actually seems like kind of moves up the list of follow-up actions taken on this sample size. Am I missing something?
Well, sir, I think it's really important to recognize that this was a systems design issue, and I think California told us that they were following up to try to get that addressed. And I think that's an important point to make, that when there is a systemic issue where it's a problem with the programming,
But let me follow up
fixing
on
that earlier. Yeah.
California actually has a vested interest in, frankly, not addressing this, because the subsidies coming from the United States taxpayer, not, in general, not just Californians. So as I'm also told, 90% of those who signed up on California exchanges receive subsidies. Now, if that's the case, again, just back of envelope, that means over 200,000 people on the California exchange potentially are receiving generous subsidies, and they're not citizens. Now, that seems more kind of the purview of the federal government as an overseer, as opposed to the Californians who may not care. Again, am I missing something?
Well, the point is that, our sampling approach was more of a compliance sample in which you're either identified as yes or no, you meet that or not.
I accept that. You've explained that methodology, but we got hardworking taxpayers who are barely making it, and who we were told by those who promoted this that only citizens would be allowed to sign up. Now, in a random sample size in California, which if it was truly chosen randomly, statistically that will probably represent the whole with a given margin of error, as many as 15% of those aren't citizens. If I'm a taxpayer in Louisiana, I'm thinking, what the heck? We were told this would only be for citizens. Now my tax dollars are going to subsidize someone here illegally, potentially. I guess I'm wondering, does the administration, your kind of view of this, and I don't mean to overread, seems a little nonplussed. Yeah, it might be, but we'll trust the Californians to pull it together. And I say that not to indict, but only to observe. Again, am I wrong on this?
Well, I think we are concerned, and that is why we have done the work that we have done to provide you, the overseers for this program, among others, the information that you need to provide that oversight. You know,
Well, I
let
thank you
know
for
the
that.
challenges that the marketplaces were facing.
I'm almost out of time. I recognize that, but nonetheless, the challenges the marketplaces were facing did not excuse them from executing the law, which is only citizens shall sign up. And it does seem as something that should require HHS to follow aggressively, if only to keep at least this measure of commitment to the American people, that only citizens would be allowed to do so. I'm out of time. Thank you all for your testimony.
Chair, thank you, gentlemen. Now I recognize the gentleman from Illinois, Mr. Shimkus, 5 minutes for questions.
Thank you, and thanks for coming, and I'm sorry I was absent for a lot of it, but that's why I waited in line to hear some of the exchange and the questions. From the Inspector General's Office of Health and Human Services, right? So you're doing an internal review of the signups, proper or improper, and you proffered a report. And I think that's where some of the frustration is some of these things come out in the report. What would compel the HHS or CMS to rapidly respond to fix these deficiencies? I guess that's the concern. Now, you're the IG, so all you can do is report, right? You can't go to the new secretary or the former secretary and say, act, here's a major problem. But I guess from the tone of some of my colleagues, they're not convinced that there was red flags flying that this was a problem and that there may have been a delay. So let me go to the I'm just trying to put my observation in the few minutes I've been here, trying to think through the line of questioning. So when CMS failed to put a fully operational eligibility system in place, we believe it had major consequences. And I think your report highlights that, yeah, there's some major problems when you don't have a fully operational system. We've learned that the verification process to resolve inconsistencies often did not start until May, right? Even though, in fact, it could be very likely that these inconsistencies contained in the applications submitted in October, is it safe to say that they languished for months without resolution?
May is outside the period that we report on, and during the period that we report where we say 2.6 million inconsistencies were unresolved is through October through mid-February for the Federal Exchange.
So we could say it languished through that period of time, at least.
For that period of time, they were unable to resolve inconsistencies, in particular those regarding income citizenship.
You think that we can, you don't know for sure, but again, going on some of the lines of the questions, is it safe to guess that some of these inconsistencies that you identified are still unresolved?
We don't have information to that effect. We will be tracking CMS's response and asked CMS to report back to us in our recommendations regarding
I guess that's part of this whole debate and a little bit of frustration. So
yeah.
So we got the answer that there's an interim pamphlet, all right? But I guess, isn't this compelling enough to say, give us more information now? I mean, what kickstarts that additional review by you to see if there's not, that the inconsistencies that you raised, that based upon the February timeframe, and maybe we assume May, that they're not still inconsistencies and that they have been resolved?
Well, we will be monitoring their response to our report, and it is a priority.
Wait. So that's the frustration. We will be monitoring. Are you monitoring? I mean, that's the problem. I mean, don't you understand? We will be. No, a lot of us think you should be. This monitoring should have been done, especially with these gross inconsistencies. Ms. Daly?
Yes, sir. Thank you for the opportunity. I think that we will do, as my colleague here pointed out, we do follow up on our recommendations, and at the same time, we already are beginning extra work out at the federal marketplace. And as part of that, we can be assessing whether the status of addressing those inconsistencies that we currently are aware of. You know, I'd be very interested in learning the new processes that are in place. Of course, that work's going to really.
Okay, so we're very, please, I guess, all right, we would like you to try, not wait, I mean, that's our frustration. If these inconsistencies are as large as they might be, and we've had a long time, then we want this present tense, not future tense. You know, does that make sense? It should be going on now. So because aren't we coming right now to another sign-up? Right? Enrollment's coming. If we haven't fixed the original sign-up and the inconsistencies, we've identified the problems, we don't have follow-up, we don't know if they've been fixed, aren't we at risk of having the same problem in the next enrollment? What do you, if they haven't addressed it, will we have the same problem, Ms. Greenleaf?
If CMS doesn't address our recommendations, we would be concerned that additional inconsistencies would remain unresolved, and that could lead to inaccurate determinations.
Okay, you've been very helpful, at least from my point. Just remember, I'll leave on this, Mr. Chairman. Present tense, not future tense, and we would all be a lot happier.
Chair thanks the gentleman. That concludes the questions of the members who are in attendance. There will be a lot of other questions from other members as well to follow up, and we will submit those to you in writing. We ask that you please respond promptly, and I remind members that they have 10 business days to submit questions for the record. Members should submit their questions by the close of business on Wednesday, July 30th. I have a UC request. I'd like to insert into the record an article in the New York Times from October 16, 2013, where Secretary Sebelius is quoted saying, quote, "I think we're on target. We are on track to flip the switch on October 1st and say to people, come on and sign up," end quote. Without objection, so ordered, and the ranking member has a UC request.
Mr. Chairman, I'd ask unanimous consent to enter into the record a letter from June 4th from Ranking Member Waxman to Chairman Upton.
Without objection, so ordered. Very interesting hearing. Thank you. We look forward to working with you, get more information. Without objection, the subcommittee is adjourned.